He gently lifted the woman's legs, then administered a muscle relaxant. Once her muscles were fully relaxed, he slowly introduced the anesthetic into her system. In less than a second, she had lost consciousness. The doctor then supported her neck, pried open her mouth with a retractor, and inserted an oxygen tube. Once she was completely unconscious, the doctor applied adhesive tape over her eyes. This should have been a routine abortion procedure, with the doctor performing the surgery while explaining it to his apprentice. Suddenly, however, the anesthesiologist sprang to his feet. He had detected a rapid drop in the patient's blood pressure, and tension instantly gripped the entire room. They watched intently as the situation unfolded. Fortunately, after a brief panic, the patient's vital signs stabilized. Though it had been a false alarm, the procedure was completed successfully. Yet immediately afterward, the woman suddenly lost consciousness. No matter how the doctors called out to her, she did not respond. The doctor quickly checked her pupils, but there was no reaction.
Oh, Jesus Christ! Her pupils are fixed and dilated!
What? The pupils? They're fixed, dilated.
The lead surgeon rushed to examine her and promptly declared brain death. Yet the woman had no prior medical history, and the surgery had concluded without complications. How could she have suffered sudden brain death and fallen into a coma? After consultation among multiple specialists, they speculated the woman might have had an allergic reaction to anesthesia. After all, in hundreds of thousands of anesthesia cases, such incidents occasionally occurred. The hospital concluded the patient's situation was a low-probability anomaly. Yet Dr. Daisy insisted on pursuing the matter further. The patient was her close friend, and she had personally recommended her for the surgery. Daisy began reviewing the surgical records, finding no anomalies in the documentation. However, she discovered a problematic lab report. The hospital had tested tissue samples from her friend, a procedure unnecessary for this type of abortion. This puzzled the husband as well. More baffling still, the report lacked a reference number and even omitted the name of the testing physician. This strongly suggested deliberate concealment, yet her husband naively assumed it was merely a hospital error. After all, such mistakes weren't unheard of. Her husband urged her not to overthink it, pointing out the hospital had already launched an investigation. But Daisy remained convinced something was amiss. She decided to seek answers directly from the lab. When she finally located the on-duty doctor, he claimed the report had been printed out due to a hospital policy where computers randomly assigned patients for testing. This explanation rang hollow. Daisy remained unconvinced. She then went to the archives to search the records, but the computer showed no trace of the code. Eager to unravel the mystery, she earnestly pleaded and finally obtained all the coma cases from the past year. But when she saw the list, she was stunned. So many patients had fallen into comas. From then on, Daisy investigated day and night. Her husband discovered her actions, and they argued incessantly. Accessing records without permission clearly violated regulations, potentially leading to the loss of her medical license. Yet, faced with a page full of comatose patients, Daisy couldn't bring herself to heed her husband's warnings. She